Hi guys, so I'm going to be showing you how to do a shear wave elastography exam. So the first thing we want to do with our patient is we want to make sure that they're laying supine. We want their arm raised above their head, and we want them as flat as possible. Sometimes you can decube them just a little bit, but we really prefer them to be supine. Another thing that you have to make sure of is that you have to be in the right lobe of the liver. And your probe is going to be in between those ribs. So I'm not going to hold my probe like this because the ribs are a little contoured just like this. So we're going to make sure that we're in between ribs. Now, on our screen, so we're going to make sure that we are done with all of our abdominal pictures, and then we're going to do our shear wave last. In order to select the shear wave setting, on the Toshiba specifically, there's a little button right here that says shear wave, so I'm going to hit that. And now on my screen, it popped up, there's a little green box, okay? So this is my sample box. My sample box can move. That's what makes this shear wave elastography instead of point shear wave elastography. Another thing that we have to make sure that we do on the Toshibas, I'm not sure for the GEs, but there's a map type here. This map type you have to twist until it says elastography. So you have to make sure that's there. Another thing that you see on this screen is these three buttons. One of them says one shot, the other one says shear wave, and the other one says quit. Obviously to quit, you would be getting out of the shear wave setting. If you have one shot on, I'm gonna explain that, and then to take your actual sample, you're gonna hit shear wave. So let's make sure that we're in the right spot. I want to make sure, again, that I am in the right lobe of the liver. I'm going to drop my depth because I don't need a lot of depth, okay? Your box, the top of your box, should be 1.5 to 2 centimeters below the liver capsule. So again, I don't want my box to be here because that's touching the liver capsule and that's gonna give me reverberation artifact. So I want to make sure that I'm below the liver capsule. A lot of times it's easy to do this with patients because the majority of patients that we have are heavier and they have a lot more liver space to work with. However, our patient today is much thinner, and we want to make sure that our box is the adequate size to do this exam. So what's another thing that we can't have in our sample box? We can't have any vessels or any ducts in our sample box, right? So here we can see that there's vessels, there's some ducts in here. It's okay to have a few, maybe in transverse, but you don't want it to be the majority of your box like this would be right here, right? So this is obviously the main portal vein, so this would be a bad place to get your sample box. Another thing that I can do in this instance is I can make my box smaller. So remember from the other PowerPoint that we can't have our box go below 5 centimeters, right? So what I'm gonna do is I'm gonna set my box to be smaller. This is obviously gonna give us less of a sample, but it's gonna be more accurate. Now I'm gonna make sure that I'm twisting my probe to make sure I'm in between the ribs and not getting any cutouts. So our box is at the appropriate depth. It's not too deep for the depth of the box. And our box is also parallel to the liver surface. Another thing you wanna make sure of is that your probe is perpendicular to the patient's skin, okay? So we don't wanna be angled like this, we wanna make sure that we're perpendicular. And another thing that you want to work on is holding your probe. So if you think about it, we have to take 14 samples. That's a lot of samples, especially if our patient isn't cooperative, like they're having heavy breathing, they're not sitting still, they're coughing, whatever it may be. So you don't want to hold your probe like this because now you're going to burn out your shoulder and your wrist. I find it helpful to hold my probe in my hand as close to the sound waves portion, the face of the probe, as possible. And I am resting my hand right here on the patient. So now I have free range just by using my fingers to lift the probe and to press the probe. Another thing that you have to make sure of is that you're not pressing too hard. Okay, so now I have all of those steps covered. I'm in a good sample spot, and now I'm gonna start my shear wave. So in order to do that, we're gonna hit this shear wave button right here. That's gonna start it. However, remember the one shot that I was talking about before? If you have one shot on, when you hit shear wave, it's going to take one sample. So let me show you. So I hit the shear wave button. I didn't hit freeze. I didn't hit anything other than shear wave. It gave me one sample, okay? Now, if I unfreeze and I take one shot off, and I'm in the same spot, we wanna make sure we're taking from the same spot, and I hit shear wave again, there's a sample. I'm not touching anything. There's another sample. It's like a running, feed, thank you. It's a running feed of samples, and it will only stop when you hit freeze. So these are two ways for you to get your sample. The way that you want to use is the one shot. You want to just do one sample at one time. That is the most accurate way to get a sample. However, when you get those patients that are really difficult to scan, that's when you're going to use you're going to take your one shot off, and you're going to use that continuous wave and feed of samples. That's going to kind of pull all of the samples together and give you some sort of a sample, especially when it's difficult. Because right here, obviously our patient is really easy to image. Our box is filling up completely blue, and we even have some dark blue areas if you can see the contrast of those. So that's ideally what we want. When we're having difficulty with that box filling up, that's when we can make our box smaller like we did, and then we can also do the one shot shear wave. If you do the continuous wave of samples, see how I can scroll through all of my samples? You cannot use all of these images. You can only use one. So you could scroll through and say, okay, this is where I see the most amount of dark blue, so this is where I'm going to take my sample. You would have to unfreeze and do another sequence of shear wave without the one shot being on. So now for us to take our sample. So we're going to hit, on a Toshiba, you're going to hit caliper. And now we have our region of interest. Our region of interest is mobile. Again, this is what makes a shear wave elastography different from a point shear wave elastography. I like to make my circle sample, my region of interest, I like to make it smaller. So here on Toshibas, you can see that there's a size button. I'm going to twist it. It says number 10. I'm going to twist it until it says number 8. That to me is an easier way to get these samples. So now we have to make sure that we're consistent, okay? Now we can't change the size of our sample, a region of interest, throughout our exam. Whatever we choose, we have to stick with. So now I'm going to scroll through my sample, okay? And I'm going to try and get a specific region of interest. So now what numbers are changing, right? We see two numbers on the screen. We have our kilopascals number, which is the actual number of the stiffness of the liver that we're getting. The standard deviation is a different number. Obviously that's a lot lower, right? So remember from the previous lecture that the standard deviation cannot surpass 2 kilopascals. We're at a 0.5, so we're not even close to being above what's acceptable. So remember that the standard deviation is how accurate the actual sample is. So now I'm going to move around, and I want to get the lowest sample possible for my worksheet, right? So I'm getting 5s, I'm getting 6s, 7, 8, 9, 14, right? Now we know that that's way too high. So I saw earlier that we had like a 5, 5, 3, 5, 2, 5, 1. Can we get a 4? Can't get a 4, but we can get a 5. 5. That's fine. So we want to make sure that our region of interest is within our sample box. If I go outside of the sample box, my number drops to 4.7, which is obviously a better number. However, that's not an accurate sample. So you have to stay within the box. Has to be this standard deviation has to be lower than 2, and our sample is going to be as low as possible. Here on this side, this is when we look on this side to get a sample. So when these lines are parallel, the more parallel they are, the lower your sample is going to be on that side. I don't pay attention much to that side. I pay attention more to the color on the left. However, you can use this as a guide. So I would set my sample. Now activated my sample, and I would take the picture. Please make sure you remember to take the picture. I did an entire elastography exam with setting my caliper without taking any of the pictures. So I had to do the entire thing over again. So just make sure that you're taking all of those steps. I know it's a lot, but the more you see it, the more you do it, hopefully it'll become easier and easier.